Over on Capitol Hill, a crisis for America's social safety net. In June, trustees sent a warning that Medicare could be insolvent by 2026. That's 3 years earlier than previously projected. Social Security, that could follow suit, 2034, when payouts could be slashed by nearly 25%. This, as the Social Security Administration is making service even more difficult by closing offices across the country. And lawmakers on Capitol Hill talking about even more proposals to raid the Social Security Fund to give Americans more time for paid family leave. Max Richmond is the president and CEO of the National Committee to Preserve Social Security and Medicare. He's in our WGN studios this evening to talk about all this. Max, good to see you again.
Good to see you,
I want to start
Paul.
with the Family Medical Leave Act thing because, you know, I know Marco Rubio is sponsoring that, and he says, this is great, what a great plan. We do want people to spend more time with their families when they have a child and all of that, and your taxes won't go up. Sure, because you're going to pay for it from your Social Security is the plan.
Well, it's misguided would be generous term to describe it. You know, that is a slippery slope, starting to borrow Social Security money. What's next? Paying tuition, paying mortgages. We are going to have a crisis, and we'll talk about that in Social Security. We need to bolster Social Security, bring more revenue into the program, not start draining the program for whatever reason.
Is that, you know, Al Gore used to always talk about what he ran. Remember the lockbox, the famous lockbox. The question is, do the laws currently allow Congress, as it sees fit, to raid that fund?
No, that is another misconception, one of the many myths about Social Security. When more money is paid into the program than is used to pay benefits in any given year, the money is invested in government bonds. Call it a lockbox if you want. It's invested in government bonds, backed by the full faith and credit of the U.S. government, and that money is there earning interest and paying out benefits on time. You know, Social Security celebrated its 83rd birthday last week, and it will celebrate another 83 if we do the right thing.
We'll talk about doing the right thing, but first, the other current problem, you've been interviewed about this and talk about it, and that's the fact that there are Social Security service centers closing down, being shut down. Customer service is terrible. People being cut from it, and yet, part of it, as I read about this, is that the government is just the landlord. It's like we don't have places to put it, but they're just a landlord in this situation. To explain this problem?
Well, we have been very focused on Social Security offices closing throughout the country. Just in the last few months, Arlington, Virginia, Baltimore, Maryland, not too far from you in Milwaukee, and here on West Adams Street last year in Chicago. There are 10,000 people added to the Social Security rolls every day, 10,000 every day, and yet we have closed 128 offices throughout the country since the year 2000. Just at the time we should be improving services, we're reducing the level of services. You try calling the Social Security 800 number. You better set aside a whole afternoon, because that's about how long you're going to be on hold. There are more people needing attention, and by the way, most of the money that is used to pay for these Social Security offices, the staff, the computers, comes out of the payroll tax. We're paying for our benefits to be there when we need them, and we're paying for service.
In an interview, you said it's difficult to overstate the importance of these field offices. In my own family, there was a need, and it was done by phone, although a necessary appointment took a month and a half to have that happen before they could schedule it. My question is, for what reason do people need to go find a field office and go there?
There are many reasons across the board. Having problems with the amount of their benefits, how to file a benefit, a change in status, a change in a marriage requires often a face-to-face discussion, and it's very difficult. You know, a lot of people say, well, you can do all this on the internet. A lot of older people aren't prepared to do that on the internet and need that face-to-face encounter.
Let's talk about the fix with little time. 10,000 people turn 65 every single day. And we let in with those numbers, sort of this panic that's ahead. Do you actually have worries that Social Security, you know, goes bankrupt?
No, I don't.
Okay, go ahead.
No, I don't. Not if, as I say, we do the right thing. We're not the group that has our heads buried in the sand. We know we can't wait till 2034 when the Social Security program won't have enough money by payroll tax, interest on the bonds, the bond themselves to make full payments of benefits. We need to improve the stream of revenue into the program. Right now, there's a cap on wages subject to the payroll
Isn't that
tax.
the answer? Lift the cap.
Absolutely, 128,400. After that, no more payroll tax. You know, Paul, most people don't realize there's a cap because they've never made any close to that amount of money. The proposal we support, introduced by Congressman John Larson of Connecticut, has about 180 co-sponsors, keeps the cap at its current level, begins collecting Social Security payroll taxes again at $400,000 in wages. There aren't too many people that are going to be affected by that. Those that are affected would get an improvement in their benefits. That would allow the program to be solvent till the year 2100, for the rest of this century.
Let me just ask you, so obviously it means the wealthy have to pay a bit more. What is the fear in doing that and raising the cap or removing the cap?
I think the fear, the political fear, is someone will be, in the Congress will be accused of being for raising taxes. This is a modest fix for a program that is very necessary for families, insurance for families, younger people, disabled, survivors, spouses, and yes, retirees.
Very quickly, we don't have any time, but do you believe in Medicare for all?
I believe that that we should have universal health care. I'm not sure that we're trying to figure out if Medicare for all, how it would impact the Medicare programs, which our members are part of right now.
All right. Thanks for the work you do. People that want to contact you, how do they reach you?
Very easy. We have a good website, www.ncpssm.org. Toll-free number, 1-800-966-1935, the year Social Security became law.
Max Richmond, thanks for the work you do. I'm Paul Listic. That's it for us tonight.